So this is just a brief agenda. I will be talking about the major trials in the neoadjuvant, perioperative, and adjuvant space, and just go into some detail on these trials, and then we'll end with some sort of conclusions or remaining questions. So to start with in the neoadjuvant space, I think the major trial here is the Checkmate 816 study. This is neoadjuvant nivolumab plus chemotherapy. So this was a randomized phase 3 trial involving patients with stages 1B through 3A non-small cell lung cancer according to the 7th edition TNM staging. These patients had to have a good performance status and no known sensitizing EGFR or ALK alterations. You can see that they were stratified according to stage and PD-L1 status as well as gender, randomized 1-to-1 to receive either standard of care neoadjuvant chemotherapy given every 3 weeks for 3 cycles, or the experimental arm was chemotherapy plus nivolumab, the PD-1 inhibitor, given IV every 3 weeks for 3 cycles. Patients in both treatment arms went on to receive surgery within 6 weeks, and then there was an optional adjuvant chemo plus or minus radiation for those patients who were felt to warrant that additional therapy after the time of surgery. But really, this trial was looking at neoadjuvant Nivo plus chemo, and the question here really wasn't more on the adjuvant space. It was neoadjuvant. Notably, in this study, 63% of the patients had stage 3A disease, and 50% of the patients had a PD-L1 of greater than or equal to 1. And so this is the event-free survival and the intention to treat patient population. You can see here that patients who received the addition of nivolumab to chemotherapy neoadjuvantly did better compared to those patients who received chemotherapy alone. And this is with regard to event-free survival. When the nivolumab was added neoadjuvantly, the pathologic complete response rate was 24%, which was significantly higher than those patients who just got chemo. And then the major pathologic response was 37% with the addition of nivolumab. So this is looking at Checkmate, the event-free survival and OS in the PD-L1 positive subgroup of patients. So remember that 50% of the patients were PD-L1 positive, and you can see here a more striking benefit with the addition of nivolumab, with both regard to EFS, event-free survival, and OS, overall survival. For EFS, you see the hazard ratio of 0.46, clear separation of the curves in favor of those patients getting neoadjuvant Nivo plus chemo. And then OS, also you're seeing a real clear separation of the curves, hazard ratio 0.37. So these are really the patients, the PD-L1 positive patients are really the ones that seem to be driving the greatest benefit.